perio procedures, you want to make sure that the teeth are completely clean. So I just go in with my scaler and clean it up. And then today, I'm looking at her gums. It looks like the gums matured a little bit more than what I first started with. But you can see, basically, is the audio working? Maybe?
I hear it.
You hear it?
It's going to be a little delayed.
Oh yeah, there's a lag, but
we're live streaming it right now.
yeah. Okay, so basically here, there was a Minnesota, and I brought this in case we wanted to afterwards more. So I think this might be better in terms of retracting for everybody to see. Yeah, that's fine.
Because when you open her up, like, you can see a bit better.
Okay.
You tell me.
This way. Like that. There we go. And then, you know what? This one here.
Okay.
1 second. I don't want to break her jaw, but like that, so it's less. Yeah, there you go. Okay, so let's see. You might have to really retract it so you could see that. Thank you. Okay, so today we're looking at the gums right now. So as we saw in the other picture, you could see that when I'm looking at the ridge, right? This area here, quite a bit of keratinized tissue, thick tissue. Here is where you have the frenum pole, and you have the dehiscence in the gum. So this is where approximately that number 14 implant crown is going to go. And this is where that number 11 is going to go, right? So we know that looking at this area, there's going to be a little bit of a problem here with the soft tissue. So we'll take a look at this area here. She has a surgical guide that we had made. And it seems like we're not going to be able to use this once the bite block goes in. But I'll take care of this in a bit. So it's okay. I'll take it on in a bit. Okay, so we're going to start with the incision. It's okay. So if you guys have questions along the way, can you just ask me so that, maybe we won't have as many questions later on down the road. Okay, so she needs to be moved this way so everyone can see. Okay, there you go. It's okay. Thank you. I'm going to move her this way. Okay, so we're going to make the initial incision. And when you make the initial incision, you don't want to make it too mid-crystal, right? So you're going to go a little bit slightly to the angle here. And then be very firm. Okay. And then actually, even on this buckle here, you could see that the amount of keratinized tissue is minimal. Okay. Suction, please. Okay. Like that. Oh, by the way, we're doing a sinus lift, so I forgot about that part. Sorry. I'm just going to have to do what we do. So I guess we'll start with the sinus lift first, because, suction please in the back. And then I'm going to move her head this way so everyone can see, okay? Suction please in the back here. Thank you. Suction right there in that corner. Okay. Yeah, that's good. So I need a little more retraction here. Okay. Okay. So that one's done, and then we're going to move to the front. Okay. So I'll go in with my Orban knife just to give it a little bit of a leeway on the buckle. Okay. Let me know when Jocelyn comes, okay? Oh, all right, Jocelyn. Let's get you started. Thank you. How was lunch? Okay.
Yes. Yeah, I saw it. Thank you.
Okay.
Yeah, one put in there. My bad.
Okay. So whenever, Can you guys see better with the TV? Okay. So then I guess Jocelyn, you and I could just command it. So I'm just reflecting it and make sure you have a sharp dissection into the bone. 'Cause my hand's in the way? Here. Perfect. My head? Oh, okay. Okay. So speaking of the biologic width, right? We don't have to discuss that yet because I'm going to start with the sinus. But when you make that initial cut, you're going to sink your probe in and see where the bone is, right? So from here, I see that the bone is here. So for this implant, this area, she has about, I would say like 3-4 millimeters of biologic width, right? 3 to 4?
They get in the way sometimes.
Okay, well, I can't help it. I can't help it. Like that. Better? So 3 to 4 millimeters. So for this area here, I don't have to sink my implant in. Whereas for the 11 area, you'll see that the bone is around here, right? And then you could see that the length here is about 3. So in this space, I feel pretty okay with sinking in my implant about 1 millimeter in. Does that make sense?
Yes.
Okay. So I'm going to start, I'm going to go back. So I'm going to start with the sinus lift. If my head is in the way, let me know. I could always change it up a little bit. Okay. All right, so this is our sinus. The bone in this area is a little bit on the thinner side. So always make sure you retract that lingual flap because that's where it tells you where your bone is, okay? So, all right, so from my CT, okay, so it's around here. You know, I think we need to move that camera up a
Do
bit.
you want me to move it? Do you want me to adjust it as you do it?
Yeah, if you
Is that okay?
can, that would be great. Thank you. Perfect. All right, so I need that saliva ejector, please. When you're ready.
If you just like when you do it, turn her head like this.
Yeah.
As you do it.
Yeah.
Does that make sense?
Yeah, we're trying to move her head. Where's the pedal? Thank you. Yeah. It's okay. Thank you. Ah. I know. And I'm wearing sandals too. I'm not supposed to be wearing sandals. Oh, so everyone else is just chilling outside. Okay.
I know.
Huh? Yeah, you guys are the intense ones. Nobody else wants to come in. What? Wait, what?
The loud ones are here.
Yeah, I know. Where's the mimosa?
No.
Okay.
Call me Sway.
Okay, this way.
You want it on a straw?
It's okay. I can hold it. Okay. So, let me see. I think it was like around here, right? Yeah. Okay. So I'm going to start making my window in the area that I'm supposed to suction, please.
Are you going to use piezo here?
Is that what?
Piezo.
Piezo? No, I use my own. I just make a window and I don't
And you
use
break
the.
it?
I just break it in. Yeah.
Nice.
Yeah.
Let me turn my head for you
Oh.
so they can see.
Oh, thank you. Perfect.
You have to know I
That's all right.
Oh.
You're doing great.
know. The camera.
Oh, there you go. I think that.
How's it?
You know, it's a little out of focus.
This is
It
perfect.
focuses
Uh-huh,
it.
that-
This is a photographer.
Does it? Put your light on it,
Like,
Doctor?
your high end.
Like that?
No.
No, still? Okay. Oh, you know what? You have to adjust the focus here. You round it up like that. Uh-huh. Yep, there you go. Uh-huh, there you go. Yep, thank you. All right, so I will try my best with my head like this. So I just make a circle here. Suction, please. Yeah. No, Dr. Daniel's adjusting it.
Using a lateral approach?
Yeah, Jocelyn, that's good. So there's at some point there's gonna be a blood vessel coming out.
And what kind of membrane you're gonna use? Bovine?
Yeah,
Yeah.
yeah. Whew. Do you think the wide one works better? Okay, all right. Let's try it. So these are desk burrs that I have come to really like. So you know when the here, maybe get the water right there. Yeah, perfect.
It's like I'm trying to work here.
A lot of cameras a little different.
Have you done this before, Tina?
Huh?
Have you done it like this before?
With the camera?
The camera,
We
It's her
tested.
first time left.
Tested?
Stop
Water in
it.
the background.
No, it's more the camera setup. It was,
Yeah, the camera's a little tricky. We tried it on a
Yeah.
patient,
Yeah.
same area on Wednesday, but it might take me a little bit longer to get the membrane. Let's see.
What is that RPM right now, Tim?
Huh?
What is that RPM right now? For your bird?
I don't know. Whatever is on there.
It's like it's 1,000.
Oh yeah, 1,000. Oh,
Yeah.
so be careful here. Okay. So important to get all of this out. Okay, right there. Thank you. Can you guys see?
Yeah. What are you doing? You're just
Oh, I'm just cleaning. There's like some like soft
Oh.
tissue
Okay.
embedded in it, and I don't like it, so I'm just cleaning it out.
So, yeah.
Okay. So again, I'm still making my hole, and the way that I like making the hole. Right here. Can you see?
Yeah. You can see it.
Okay, so now you see the sinus membrane, right?
Yes.
So what we're gonna do, I typically like to just increase the sizes as I go. I'm like kind of like small and then bigger, small and then bigger. So we just have to make sure we protect our airway. Okay, so don't suction yet. So once you get to that bony window, okay, maybe dab for this one. Okay. Thank you. And then the small ones, you might want to cut it. Just be careful. That's it. Okay. I'll hold on to it. Okay. Oh, thanks. Okay, don't worry about
Does
it.
that affect your surgery?
Huh?
Does that affect your surgery if you turn
No, it's actually okay. Okay. So, just stay right there. Thank you. And I just break the sinus membrane. Yep, that's perfect, Jocelyn. So I'm just trying to make a little opening into the sinus. I don't know if you could see. There you go. So now I made a window. Right? I see the bone. Okay, perfect. So now I make sure there's like no little bones sticking out. So now I'm going to go in and make this window a little bigger. So let's water, please. Okay. Hey, maybe we'll be done before 3 today. That would be nice. Okay. So I'm going to move her head this way, okay? So we can see.
Can I try something? Let me
Yeah.
just take her. Let me see if Juan and I can just take her.
Oh, okay.
Right there.
Yeah, like her
Let me see if it'll
head.
help you.
Yeah. Perfect.
Do you ever puncture through the membrane or you're
Yeah, that's a big uh-oh.
Oh,
Okay.
really?
And
Well,
then-
yeah, because if you puncture through the membrane, then you have a perf, right? So you don't want a perf.
I've seen it with the surgeon puncture.
It'll be hard for you to push in the membrane after.
Yeah, so then you
How do
just have
manage-
to,
Yeah.
Let it
we have to
heal?
repair it.
Yeah.
So you just have to, yeah.
Oh, yeah?
Suture or no?
You don't suture.
Yeah.
If you suture, it's going to get bigger. So you just have to lift it up and continue to do it
And then,
with sweat down your back and hope for the best.
Right.
yeah.
Okay, here, let's see.
Oh, so it was a huge puff. I got some surgery, it was a huge puff.
Oh, I think that looks fine. I would say just like that.
Yeah.
And then we would have to,
That's good.
that looks good?
Works for the.
Okay, perfect. Okay. So,
Oh, that was perfect.
okay. So a lot of water coming through, okay? Okay.
You can have one doctor.
Oh, yeah.
But he's an observer. As an anesthesiologist, that's what he does best.
Depends on the day.
You go to
Depends on the
different
day.
place, you get different options. Oh, this is the car.
Definitely, yeah.
This is deep today.
You're opening the window?
Mm-hmm. So here. You see? There's a sinus membrane. I think it needs to be,
No, it's okay. But when you move it, it's
oh really?
Yeah.
Okay.
But right now it looks good.
Oh wow, you know, I was checking her blood vessels today. Oh, we've done sooner than later today. That's awesome. Yeah. Let's not jinx it. Let's not jinx it.
Yeah.
When I say that, always ends up being later.
Yeah,
So we're basically making that window.
I think he's like putting touch with.
Okay, so now you see the window, right? She's
Yeah.
breathing. Well, if she was not sleeping, you would see that membrane kind of like in and out, and you tell her to like breathe in, and then the whole sinus kind of comes up, which is kind of fun. Okay, so now you might want to dab. Thank you. So we got that tiny window, and then if I need to expand it, I'm going to expand it, right? You know what, this one is going to be clear. Let me just not get more.
So when we started practicing for Thomas our company, we're supposed to do it on egg. Yeah, I opened I think I don't know 30 minutes.
Huh?
Practicing on eggs.
Practicing for sinus On we eggs. started practicing on
Yeah.
eggs. Yeah. So you open the egg and push the.
Makes sense. Yeah.
Well, her sinuses are very nice to work on. Okay, so now we could bring up the gums without worrying. Okay, so I'm going to bring it up again. Thank you. All right, so we're just going to go and lift. A little bit.
You can see it.
Yeah.
So
Okay.
you're separating it from the.
Yep, yeah. We might need, so I think I hit the artery now, so you could see more blood coming out.
Yeah.
So let's,
That's one of the things you have to.
I'm gonna just keep this right here, okay? Thank you. Yep, it's definitely bleeding.
One of the things we're always afraid of.
It's okay, I got it. Thank you. So I'm just going in, separating the membrane and the bone. If there is a perf, then at that point you go in the corner and cry and try to repair it. So I'm just lifting up the corners just to see. So I don't know if you guys could see, there's a membrane getting separated. And that's the balloon right there. Let me have you go back a bit, Dr. Okay. Only because I'm there. There's one corner getting stuck right here. I'm going to bring it up. There we go. So now you can see that balloon up. I don't know if you could see the cavity.
Yes.
Maybe it shows better in IRL. So now,
Lifting it up, right?
Yeah.
yeah, so now you see
Creating
everything
space.
lifted up.
Nice and bouncy, yeah.
Nice and bouncy.
That's how you want it.
That's how we like it. And then,
And now you go.
Up the bone.
so then after this, well, let me just make sure it's fully elevated.
And how deep will you go? Like the head?
Deep, just up to about like 12 millimeters, so that I could place a 10 and I'll be happy. Right, so typically I prefer external sinuses to internals, because externals I could see what's happening.
Yeah.
Internals,
You don't know.
there's always a risk of perforation, and even if you perf later, it kind of comes down a little bit, the bone, so I'm not really a fan of internals. But for her, you know, she had about 5 millimeters of bone there, so we just left it there. Okay. So now we're going to go ahead and place her membrane, and I like to have a barrier there just in case. Let me just leave this one for her. Should we rinse her out? No. Okay, I'm okay. Let me see if this is too big. So I just like putting a membrane there just in case, because when I go in with my burrs, it could drill into the sinus membrane. So I don't like putting that there here. I don't know if you guys could see. Wow, this image quality is awesome.
It's a good job.
Yeah. All right, so I just tuck it in. So now you know.
Like a little more, you'll see better.
Oh,
There we go.
Better?
Perfect, yeah.
all right, perfect. Yeah, so it's in there. So now you can see all that space here that I'm going to fill with bone. And
The good thing is the gravity will do the work for you. So.
yeah, so for her, from the crest of bone, this is about 12 millimeters, so we're more than away from it. So now what we're going to have to do is, yeah, let's get a little bit of bone. And then we'll open it. I'll have you use that. I think we'll finish early.
Yeah. Friday.
Wow.
Friday.
Yeah, we'll go get a mimosa. Phew. All right, this is great. So, huh?
We'll need shots at the end, no, joking.
Christina barely drinks. They're listening to you like you actually
I
do
know.
Okay. Where's the...
And ask what if you don't use a membrane and you just lift it and you pack?
You can do that,
You can? Okay.
but I have my own technique. You know, everybody has to do their own thing.
Okay.
So I personally like having a membrane, especially because on the x-rays, when you do the bone graft, that membrane line is very distinct. So I'm like, okay.
So you can see.
I like it personally.
Because can actually like do micro perforations in the membrane.
Yeah.
It's kind of good standard for you to do a membrane. Okay. Yeah.
Yeah.
For whatever. With my
But you could. I mean, like there was an extraction that was recently done, and the tooth was literally on the sinus. So when I took out the roots, that one of the roots was like dwindling in the sinus, and I was like, oh, fun. And then when you take it out, you could see the sinus. So that was kind of interesting. Oh, ready? Okay. So we'll just fill it up a little bit, and then everything clean. Okay. I think I got too much bone. We end up always opening too much bone graft, and then it becomes a waste, but whatever. Yeah. A little too eager here. It happens.
Pack it up.
Yeah,
Fill
pack
it
it
in.
up. Okay. So we're just going to add a little bit by little bit, because you need to account for some space of the volume of that implant to come in as well. Okay. Can you see?
Yeah, retract a little.
Retract more.
Retract a little more. Here. That's good? Okay.
You can see now.
What about healing time when sinus lift is involved?
So the healing time, typically if you're just doing an implant
Yeah.
or the sinus lift, minimum like 6 months.
6 months.
But if you're doing an implant like hers, she's going to have primary stability from her bone here. So, in that situation, I typically just say 4 months.
So on
The
this
bone will
case,
continue to grow. Huh?
will you drill like one drill shorter and actually go in, or you're gonna go to the implant size? the
Say it again?
diameter itself? Because your deal is what deeply down here. I'm asking about the diameter of the pore for the implant. Are you gonna go a little like smaller for the stability of the implant, or just gonna go to the diameter?
Oh, the drill.
Yeah.
Yeah, we'll see. Maybe.
How you feel as you're going?
Yeah, I
Usually that's how you do it. You have to feel like the bone.
Yeah, I just do whatever I want. I'm just joking. I'm just joking. I do not do that. I do not do that. I do not do whatever I want.
Take it back.
I do not do
Hold
that.
it, Tina.
Yeah.
This is live stream.
On YouTube, I'm like, oh no. Oh no, but typically yes, you under prep the drill a little bit, so that you have a little bit more stability. But sometimes if the bone feels very hard, then yeah, you have to drill a little bit with the final drill. But yes, you are correct. Like you want to under prep it a little bit.
Exactly. That's,
Yeah. So you're
Especially
correct.
when preserves next to
Yeah. So I'm gonna squish it more towards the mesial. So this part takes a little bit of time. We have a plugger, but it never ends up working anyway. So just pack it and take some time packing it in.
How do you know it's enough? To what point do you go to?
When you feel some resistance.
How many cc's of bone did you open?
Huh?
How many cc's of bone did you open?
One.
One?
I think it's too much.
Looks like a lot.
I know. It is what it is. Jocelyn is laughing because I always end up opening way too much bone and then we throw it away.
I know.
So then she's like, this is not new.
Painful.
It's like, do not touch my budgeting orders now.
Yeah. Exactly. Oh man, you guys should come to all of our surgeries. This is so much fun.
Yeah.
We're not gonna let the, we'll be a sleepy session.
Yeah, so we're just putting some bone, just spreading it around here and there, wherever it's supposed to go. So I'm just gonna fill it up to here for now. Let me get that suction tip, please. The small one. Okay, so now we're going to go into the implant portion, which is, I would say, is always a little bit more. Yeah, so let me just hydrate her gums a bit. Okay, so now we're going to go into the implant section. I think she's, there's a lot of water in the back. So let's suction it up. Do you have to do a gauze change, you think? Hey, do you think we need a gauze change? Yeah. Daniel? Yeah, look, there's some blood coming out of the throat, so I just want to make sure before we go to the next.
Yeah.
Yeah? Okay, let's change the gauze. A little break.
Good. Amazing. Love it. Love surgery.
So Tina, how many cases we're doing today? 3?
Huh?
How many cases are we doing today?
You know, so
Let's keep going.
the problem was I told the rep and I was like, hey, I want to do this, I'm gonna do it. And he's like, no, the day always like runs late. And I'm like, oh, okay. So then I was like, oh, that's a good thing because I was gonna schedule 2 cases. So then I was like, okay, let's do 1. And now I'm just like, but it's whatever. It's okay.
I do the same thing every day. I always miss my gloves.
Hmm?
Oh,
One more.
3.7. So these are the implants, the BLCs that we were talking about, and these are the AHAs. So we'll just be putting AHAs today. So you guys will see. I think these are right. So with the AHAs, like this is what it looks like. So based on, here I'll show you to you guys with the thing. Oh, AHAs. Oh, it's okay, sorry.
Yeah.
Maybe you could do it when you're done.
Oh,
For
okay.
me, outside of the light.
Oh, okay.
Okay. Whatever you want to do now. You can move it around.
Oh, here.
Yeah, thank you.
Cool.
And
So
this is
these
what
are
you're-
the AHAs that I was telling you guys about.
Her mouth, there's nothing on it.
Oh, okay. Yeah.
Just get scanned as it's
Yeah.
like that, right?
Yeah. So if you look at this one we're going to be using it on our canines. So that's why it's shaped like a canine when you do a cross section, right? You see? And then there's a flat surface on that one end over here, right? And then the dots, right? And then the other one that we'll be using for this one is a bit wider.
Is
So
there another 4x4 over there?
You want to?
there we go. So this one's for the molar. So you could see cross section,
And a piece of tape.
same thing. Hard to see the dots, but it's all there. Yeah. There we go. Yeah, so basically you could see the 2 dots on the side, flat center, all of that, okay? So we'll just be using these today. Okay.
All yours.
Ready?
Yeah.
Okay. All right. Bye. Okay, so let me see. I have a cheat sheet because I forget what drills I'm supposed to use. So I'll just see.
Yes, yes.
Yeah. No, because I forget too, so I have to know. Let me see. 3.5. Yeah, because we use different drill sets.
Yes.
So we're kind of like, I'm like, which one am I supposed to use? What's a 4.5? Okay. So since they're soft, we'll go to 3.7. I'll just leave this out here. Okay. So from here on, we have to use that surgical guide and see if it fits. So this one is a 3.75. Uh-huh. So 3.2. 3.2. And then 3.7. Okay. Okay. So let's check if it fits. Does it fit?
She's flipping. There.
Okay. All right. So they said it's a Nobel drill set. So one of the things about these guides, here, let me see if the focus is back. Oh, the camera moved.
I got it. Don't worry.
Maybe.
Okay. Like that. So one of the things about these surgical guides is that, when you have a surgical guide, just check if it fits okay. A lot of the times, the soft tissue is in the way, right here. So, you just have to account for that. Another thing is, typically when I use a surgical guide, I don't use it fully guided because I would say a lot of the times, I would say like maybe at least 5 out of 10, the guides are never correct. So when you're doing like full arches and whatnot, there's always something that's a little off. So then I just use it for the pilot, and then from there on, I just freehand it. Because if that initial hole is wrong and you keep using that guided, and then later you take it out and you're like, oh my God, the buccal bone is completely gone. So I personally don't like the thingamajig, but it is what it is. So for me, I have a little bit of a hybrid where I mix my Nobel and Straumann burrs to whatever I want it to be. So this is from Nobel, it's not from the Straumann kit. Suction, please. Yeah, I'll take it. I'll put it on this side. Okay. There we go.
She's closing, so I'm just gonna.
Okay. You're okay there?
Yeah.
Okay. So from this. Oh, perfect. Thank you. Okay. So I'm just going to use this as a guide to kind of, sorry, my head is in the way. But I'm just going to see if this guide is truly correct and then go from there. So I'm going to make an initial hole and see if that is even correct, okay? Okay. And then this one. And then you could see these markings where the pilot hole is supposed to go. I think that's soft tissue right there.
The markings, you're talking about the lines?
Mm-hmm.
Okay.
Yeah, so the lines are what I'm trying to okay. So from here, I just make a little tiny pinch into the gums, or into the bone. And then we're going to assess what it looks like. So when we search for the bone, or the markings, it's okay. And the camera's a little off.
Let me put it on.
So where did they put the markings, do you think?
It's not staying.
It's not seeing
Yeah.
the camera?
I'll hold it as you do that thing.
It's okay.
Look,
It's okay if
when
it
I
just
let
stays
go,
like that. Uh-huh. Oh, then we just have to move the position of the camera.
What's the
Here.
thing?
Yeah.
Marta?
Yeah, where's Martha?
more towards yeah.
There you go. There you go.
Perfect.
I think that's a little low now. It needs to come up this way. There you go. Okay. That looks centered. Okay, so let's see where that hole went because I can't find it. Where do you think it went? No, it's okay. Where did it go, right? I'm like, was it here?
How far do you go down to? Like a millimeter
Just
or two?
until I could see a dent. That's obvious. So let's see. It's like, I'm pretty sure I put it somewhere around here. Yep, right here. Nope. Right here. Okay, so that's pretty damn good. So right in the center there. Okay, so I'm like, okay, I like the hole. I'm going to continue with it. If I don't, and then right here, I put it around this area here. So then I take a look, and then I realize wherever I put the hole, it's in the lingual. So that's not going to do, right? So I'm just going to use this one here. I'm going to continue for this one. I'm going to move her this way. Sorry. Thank you. Right. This one doesn't look centered. Okay.
You must have watched them and we regularly that you probably clear answers and no program. I missed the order.
Oh,
All
yeah.
types of
I know.
He's talking about me.
Sorry.
He's saying I've seen so many surgeries.
Oh yeah, you could do anything.
Yeah.
He's judging you, Tim.
I know. He
That's the
is.
one thing I don't do. I would never judge anybody.
Yeah.
Unless they're totally
Once you're working on the leg instead of the teeth, then you're like, oh, wait a
You
second.
have to say something then.
Yeah. Okay. So let me just make that initial drill first.
Then they're like, hold on.
Yeah,
This
you're
stage is a little light. Let's stop.
Yeah. That doesn't seem right.
Not for the day,
I have
right?
stopped surgery.
Really?
Yeah.
Really?
But because of what? Like health?
You saw how bad it was?
Oh,
Really?
really?
Wait,
See?
suction just a bit.
Wow.
Read the whole.
Patient's health.
Yeah.
Okay. So even then here, it doesn't look like it's fully centered, right?
You need me to open her? You're fine.
I'm okay right now. Yeah, this one. Yeah, she does have to open a little bit.
We can use the bite block now. I already
Really?
took it off for the...
Okay. The center, this piece is always a little bit stubborn. Actually, no, I still need this for this one. So let me just put it in here. Sorry, it's like you always have to measure twice and cut once. So when I'm like trying to measure this, it's like, Okay.
That's a good quote.
Yeah, I think I might have just made it up. You know, no one's ever. Okay, so we're gonna put it right here. So let me just see if I'm just trying to get the mesial distal now. Okay. Okay. So let me just make a dent. It doesn't matter where it goes. So maybe like right here. And it's delayed over there. Okay. Let's take it out. Bite block please.
But you're also not using the guided burrs, right?
Hmm?
You're not using the guided burrs.
Burrs. Guided burrs?
You think?
No, I like so like for instance like even for this one hole looks good. The other one is off a little bit.
I'm talking about the initial girl. Yeah, the ballot girl.
No, I just like using my own method. But no, sometimes you can, but suction please. The reason why I'm starting with a small tip is because if I make a dent, then I still have a lot of leeway to change that position. But if I start with a 2.0 or 2.2 pilot, and I make that hole, it's like, oh, you know, that's a bigger dent. So I just like kind of confirming it where it's supposed to be. So for her, it's like somewhere here. There's like soft tissue on that one too. I have to take that one out. Okay, I'm gonna move her head this way, okay? Thanks. There's soft tissue here. Not the right one. Okay. I'm gonna hold on to her head, okay? Something like that, please. So it's like right here. Okay. And then we'll take an x-ray after this. Okay. So let me move her head this way. And hold on to her. There's a hole. So I'm always looking for the hole. Is it here? Yes. Was it here? Yes. Really? It was too close. Here, let me do this hole. Suction two. Okay.
Look upside down.
Hmm?
You want the down?
No, it's good. Let me just see if this is. So this has to be placed a little bit more lingually if I can, based on the buccal bone there. This is a little bit, yeah, we're going to move it in a little bit. And then this one, I think that's the hole, right? Yeah. Yeah, this one is also distally tilted. Let me just move her head this way. Sorry, I can't see as much. Let me get that floss out of the way. Other end.
Tired.
Yeah.
Right hand or something.
It's okay.
You're good.
We're going to move it. Yeah, okay. Where is it? Okay. I'm going to move it this way, okay? Okay. So this one has to be a little bit more tilted to the left. But other than that, let's just see where we are in terms of the angle. So this implant is not placed in the right position, okay? But you're going to have a little bit of a discrepancy in terms of the occlusal because in the anterior region, the teeth will flare out towards the buccal. So this side here, it needs to be tilted a little bit more inward and a little bit more mesial, but we'll correct that as we go, okay? Marta took it.
Somebody walked out with it, yeah.
Marta might have taken it. Huh? Yeah. So then we're going to clean up a couple of things because you don't need it. So should we go? All right, so we're going to leave the room for the x-ray for Jocelyn. Hey, the visual was really nice. Yeah. It came out really clear. Yeah. All right, Marta. Yeah.
What's going on right now?
Oh, she's taking an x-ray.
They kicked us out.
The what?
They kicked us out.
Yeah.
Yeah. Yeah. Wow, there's like a huge laugh. Oh, you guys are just having like a. You guys are just having like a little like bachelorette viewing party or something. You guys don't want to come inside?
Yeah, I'll come in.
You can't see much.
Yeah.
You can't see much. Okay. No, I need to stop talking.
Why?
There's the mic.
Oh, you want me to meet it?
It's okay. It's okay. Hmm.
Yeah, it's like 5 seconds.
Yeah.
Yeah. Yeah.
Is it just the audio that's lagging, or the?
Well, the audio is also the video. It's because since it's
So the video is also lagging.
since it's streaming,
Okay.
there's going to be a light lag.
Oh.
So we run 30 seconds to 5 minutes.
Ah, okay. So it's like I cut the papilla, and it's like 5 seconds. Okay. I see. Yeah, her sinus lift, like, it was so easy today. I was like, oh. Like, you know, like the initial like round thing that I was cutting, like usually there's more resistance, but hers was like, oof. And I was like, this is great. You don't feel it, you see it. You see it. You see, yeah, like a little like gray film. Yeah. But yeah, but hers was like so easy. I was like, oh. This is usually there's a little bit more work. Yeah. I know it came out easy. It was very easy. Her sinus. There wasn't two, but that first one. What's up? Oh, okay.
I know, we're all
We're all just
We're so used to
gossiping.
being like, oh yes, yes.
Hey, where's the other one?
Here.
Okay, so we all have to tilt it a little more. That one looks a little off, actually. This one looks off. The one in the back.
That one.
This one, I need to upright it more. Okay, so it's not the back. This one is not right. Yeah, that one's not right. So
Yes.
that one looks actually fine. It's this one that needs to be towards the distal. So I'm gonna move this forward a little bit, and then go from there. Okay. So let's see. Okay. So that back side, let's do it again.
You're good with 11. You're happy with 11? You said?
11? Yeah, the 11 looks fine. Like, it's actually a little deceiving. So 11 looks fine because we're looking for the occlusal table here. This one's tilted too far back like that. So I need to move this way. That means I have to make another cut. Yeah.
Using the same hole though, you're just gonna correct? Or?
No, I have to make another hole.
Okay.
Make a new hole. So, yeah, so now you know. It's just sometimes it's hard to see in the mouth because, so it's basically like 90 degrees to the occlusal table. So for her, yeah, and it's because also it's on an arch.
Do you want me to hold it?
Okay, here, I'll do this. Like that. Okay. Come on. Okay. So right now the implant was like here, and I'm not liking it, so I'm gonna upright it this way. Let's see. Not liking it, I'm gonna upright it this way. And then it becomes brain guided, you know. Like you just have to. Let me see. And then let me just check a couple things. So the way the trick that I have, is you know this custom healing abutment? I know where the center of that implant has to go, and it's like right here, okay? Right? Because that's where the ideal crown height's supposed to be. So if I'm drilling right here, I know, okay, it's a little close. So I'm gonna go a little bit more, make it to this side here. So that's how you know. So for her, I'm a little off. So therefore, I have to do it again. So ideally, it would be somewhere around here. Okay. Let me just put it right there. Oh man, I'm hungry today. So I'm gonna go with my short drill. Let me see if it fits first. So now I'm going to go to my second drill. And then parallel it. And let's see if this fits. Okay. So when I go in with my custom healing abutment, now that I know, okay, and I would say this is pretty acceptable, right? Like if it comes out here, that's perfect. So I'm gonna keep that position. And I'm gonna finish off with that front side. So I go to the next drill, which is a little bit thicker than the other one. And you could see on the bottom here, I don't know if you could see, it goes through the whole bone, like through that sinus area. Let me check. And I go to 3.7 for this one. Sorry, I just like to check because I don't want to be. Yeah, this is good. And then 3.7.
The final implant size is 3.7?
No, the final implant size will be 3. 4
4.5 for your.
yeah, 4.5. So I'll go to 3.5 here. Okay. So right here. Okay. So it's just like incremental areas, and then 3.7 is the last one. I might not go all the way in. Just a little bit off to the side here. Okay. So the first implant that we'll be placing is this one. Let me rinse her out a little bit. Everyone kind of left, huh?
Everyone what?
Everyone just kind of left.
Yeah.
It's okay. Okay. So basically from here, in terms of, deciding how deep to place the implant, suction please. Again, this is about 3, almost 4 millimeters, right? So I'm going to sink the implant in a millimeter in. Close to a millimeter, okay? So I'm going to switch into my thing.
On the last drill, why did you barely go in?
So with the last drill, I don't want the implant, it doesn't have a lot of stability because there's no bone on the top of the sinus. So because it's a vacant hole, if I were to place the implant, like it might not have stability. So you want to make it tiny bit smaller so that you give it more space. Yeah. Okay. It's gonna be cooked. Okay. All right. Did we irrigate? I forget. Okay. So the first implant goes in. You could see I could even like squish it in already, like that implant. Not Again, I'm gonna make sure that right now it's still a little short, right? I'm gonna torque it in now. Oh, please don't fall. With this instrument right here. And again, I'm gonna go in. Come on. I'm gonna get more engaging.
And can you actually mess it up by hand poking through it?
No.
If it doesn't go easy, would you back it out and?
Yeah. What do you mean?
I guess if it didn't go to bone level right now, or a little bit like a millimeter above, would you back it out and put it, kind of expand the bone? Or no?
Expand it a little. Can you repeat that?
Like if the implant didn't go in as ideally as you'd like, you can hand torque it all the way down.
No. I usually hand torque towards the very end. Because, yeah.
So
Because
if you reverse it out and then put it back in?
reverse it out and then put it back in, yes. So now you were talking about shaping the bone, right? Yeah. This is a trephine, like a little pin to help you where the trephine's supposed to go. So I'll explain it to you. I screw this screw in there. And then what you're going to find is there's these trephine drills that you use around your implant. Water. Okay, so this fits into the space here. I go in, and then once it engages, then you know like this is how much bone that's supposed to go around that implant space, okay? So this is how, go in. This is how you make sure that the bone immediately around the implant is gone, okay? So now, the thing is, so you could see that around that area, there's a halo donde is my probe? There's a halo around the space, right? So let's say I were to remove that. I forgot what these pins are called, but yeah, come on. I'm gonna take this out. Okay. So I take these pins out. So now you could see that there's different undulations around the bone, right? Like what's this riggedy raggedy stuff, right? You have to smooth it out. Traditional osseous. It's a lot of water coming through. So I usually just use my high speed because I have control over it. Okay. So same thing here, a lot of water. So the osseous contour, so when you remove the bone, we're not removing bone straight right next to the bone here. There is no point in doing that because that's what's going to help you preserve the papilla, right? These ledges, where's the water? Okay. So this is all perio does, right? We contour the bone so that it has a smooth underlying surface. And you have to be careful never, ever, ever to touch the implant when you're doing these. So you have to contour the bone around the area for the patient. So like these areas here. Oops, did I touch that? Oops. Maybe. No? Okay.
And that's to make the gingiva afterwards look not so jagged and nice, or?
Yeah, you have to smooth it out because every time the bone sticks out, the gum tissue is going to follow directly into it. Right. So that might, remember like those indentations that we first had? Yeah. In the bone, in the gums, this is what is causing it, right? So towards the end, I will, what is this? I will contour it a little more. Okay, this time. So these areas, I'm going to smooth it out a little more. We'll polish it towards the end, and then we'll get a new number 4 drill. Actually, let's just do it now so I could finish up with that healing abutment. Yeah, can you get one? Thank you. That's okay. Yeah, we just need a new drill. These burrs are old. How's she doing?
Excellent. All good over there?
Yeah, I was telling everybody the sinus lift went so easy. I was like, oh, this is
honestly,
great.
How great of a job you did.
Oh,
and
thanks.
worked for a periodontist for like 12 years. So.
Oh, no, I mean, hers was just easy. Like the ones that just, hers was an easy case. There was another.
Way, you made it look easy.
No. I don't think it's that. Hers was easy.
Are you placing a third implant in between or just 2?
No, just
Did it
2.
make a bridge for her or her?
Well, she has, her general dentist is in Thousand Oaks. So,
Who's her general dentist?
so she is an assistant, or she's a sister of an assistant that I used to work with.
Yes, I recall.
So
Her sister still works somewhere?
that's the one that I was telling you that has Saturdays available.
Where does she work?
Thousand Oaks.
Yeah, who?
For Dr. Laura Fothi. Very nice doctor, but she's in Laura Fothi, Fathi. Have you heard?
Yeah.
Hers is like her patient pool there, like very old patient, but her sister's been there for like 20 years. Like very friendly, like family style kind of practice. But yeah, so she's the sister of the assistant. Yeah. All right, so let's shape this bone, okay? When you're ready. Okay. I think we could see it from here like that. Yeah, thank you. This is just a crest. So again. So any undulations. This is going to do a little bit of a nuance.
You ever do the smoothing of the bones first before you put your implant? So
You-
that you're not worried about
You could. I didn't do it, but you could. You should. But
Or you're saying just like rub it on.
yeah, like level the bone. I'll do it on the other one.
a little bit, yeah.
Yeah.
Put it in so that you're not worried about.
Yeah. Usually that that trephine burr
Yeah.
that I was showing you, that usually does the trick. So
Because you want it along the way.
yeah, maybe we need to have a drill extender. Where is it? I'm trying to find a drill extender. Is it this? Let's see. Let's see if we could trephine it more. Because, yeah, this typically does the trick. Where is the drill extender? It's hiding out here. Okay, water. Oh, we don't have to pin in there. Hi, Dr. Michael. How are you?
Good.
All right.
Got
So,
permission to leave.
oh, you got permission to leave? Okay. Yeah, we're doing we just did a sinus lift and we're doing an implant
I'm watching.
for Christina. Yeah. So, let's see. I think that's pretty much it with her bones. Open this a bit. You know what? Oh, open? That's okay. Let's see. You know, we have some good Korean food upstairs on the 5th floor. We have some good Korean food.
I heard that.
Oh, okay. If you want to.
I don't want 2 minutes and then we'll go put on the plane.
Okay. We're okay with the water, right?
What kind of implants are these?
So these are Strawman, but they're also like they're the newer BLC implants.
Yeah.
And I was telling everybody the reason why we're choosing them is here. You want to stay for this part, okay? Here, let me just remove all of this stuff.
Oh, the BLTs look great.
Yeah, this one's a BLC, so it's a little bit newer on the market. And then let me show you what this is about, okay? Okay.
So you did the sinus lift, now you're doing the implant all at the same time?
Yeah, so here. So the sinus lift is right here, Dr. Snyder. Oh, where's the camera? Oh, really?
Ask him, please,
Yeah.
I don't know,
It's right there. It's supposed to be charging, but I guess it's not.
you don't
Oh.
want to risk it, you know where it's
Oh. Can we tell? Here. We just do it
It's
like
already
this.
charging.
Oh, it's already
Hello. Any luck? I turned it on and off. Oh, okay. Oh, weird.
Water at the magic touch.
It's off?
Is it loose lead?
You think the battery's dead?
It's off and on. They with the off and on.
Okay. So what should we do?
It's off.
Okay, so we proceed. People won't see the healing of it. Yeah.
You want to try to take it off and charge it in a different plug, Margo?
It's on now.
Yeah, timeout.
It's back on. It goes on and off.
It goes on and off.
And then on and off. What if you spend so long?
I'll just turn it off for now.
Mm-hmm. So I'll just put this on later then. I'll just do the implant part, which is a little more boring. So this charger doesn't work then.
So Doc, how much are you able to push up the sinus and do the implant all at the same time?
Yeah, so she had 5 millimeters of bone, and then we lifted it up to 12, so 7 millimeters. So we did a partial bone graft. And then once the implant goes in, I'll fill up the rest afterwards. Yeah. Super fun.
Are you gonna do the sample?
Better you than me.
I'll take a oops. I'll take a look and see. I'll take a look and see. Yeah, the camera. Okay, so you know what? Let's finish off the implant, the one in the front at least, because this one's at least a little more boring. Or actually, I do need this, so I could see the direction of the implant. So let's put this in. Ready? All right, so you guys, we're placing the AHA abutment. So we're going to be placing that buckle, the flat surface towards the buckle, okay? Hang on a second. You know what this tells me? You need to sink the implant in a little more. This is not right. Okay. Yeah. So we need to sink it in maybe 2 more millimeters. No, actually 1 more millimeter. We have to sink it in a little deeper. Okay. So how I was just kind of measuring that is that these AHAs, they're either 4.5 millimeters or 4.5 millimeters or 5.5. So these are 5.5. So if the healing, if the biologic width has to be like 3 to 4, it means that only a little tip of that implant, this part has to show up, right, to the gums. So when I tried it on, I'm like, hey, there's still this significant portion peeping out of the gums. So that tells me, okay, I need to sink the implant in a little deeper. So, so what I'm trying to say is, these implants, you think they're simple, but I'm like, whoa, there's too many little things going on. Okay. Where is... Do you know where the implant driver thingamajig went? Not this. Oh. Okay. Ready when you are? Oh, okay. So let's sink it in a little more. And then we have to do the whole trephine thing again. Okay. Okay. So the trephine thing again, so because the bone level is now different, right? Okay. Water. Two, one. Okay, so now you can see the difference, right? In terms of the bone. So now I'm going to go ahead and trephine it even more. So do you guys see like the difference in the step, right? So now, oh, just like osseous. Let me take this off. Okay, ready? Okay. Right, so a little bit more trephine. So keeping that bone around that tooth next door.
Fine bug, you know?
Hmm?
It's really fine. These are really small bugs.
Yeah. Because I'm getting close to the implant, so kind of like, I don't want to. Okay. So from here on, I'm going to rinse that area out. A lot of water, please. And then let's put in the healing abutment and see if it goes in this time. Ready? So now when I place it, you see that the gum tissue, it's at that level that we want it to be. Yeah, you could see that, right?
Yeah.
So it's at that 3 to 4 millimeters, just 2 millimeters peeping out. So let's say if I'm the gums, this is how you know that area is done correctly, okay? So these implants, when you're making these biologic glitz, you have to sink it in quite a bit. So it's a little counterintuitive, but you know.
Are you rinsing with just regular Paradex or a higher strength?
Paradex. Paradex. Okay. So we're going to continue off. Sorry?
No, I'm just talking smack about myself.
Okay. All right, so we're going to finish off with this implant right here. Oh, sorry. I thought it was my thing. But you know what then? Maybe for her, this side we might need the Versa bird. Let's see. Let's get the Versas. Okay. So that bone is a little thin. So we're going to expand it with the Versas. Huh? With the Versas. With the Versas, yeah.
The verses are fine.
Yeah, they are. Oh no!
Whatever, you're sorry.
No, it's not that. It's fun, but I'm just
Okay,
seeing.
you're gonna expand it, is that what you said?
Yep. Ow.
Careful with those, right?
Sorry? Sorry.
You said to let me use them.
So yeah, the bone is a little thin. Thank you. The bone's a little thin, so we're gonna expand it. Okay. So you guys are just gonna have to see this. So where is that hole?
It's just a bit. There's no, you know. It's already done. You're going to put in a different.
So now I want to go from this. Okay, so I guess I could move the implant a little bit more mesial, or, well, actually, I'm going to leave it as is, and her canine's going to be a little thick, okay? Cut a little round, because if her crown's going here for the 2 molars and the premolar, that's going to be, she's going to have fat crowns, basically. Okay. All right, so we're going to move forward. It's a 10 millimeter implant. This condenses the bone around, so it expands a little bit as we go. Okay. And we're going to go in a little bit deeper because for her, in order to create that biologic glitch, it's going to be a little bit deeper, okay?
Can you explain it again?
Yeah, so these are burrs that, you know, when you cut, it cuts clockwise, but they designed the burr so that when you spin it counterclockwise, instead of cutting the bone, it condenses the bone around it. So these are...
So instead of removing, it's compacting. Yeah. It's stacking apically and laterally.
Yeah, so it's kind of cool in that sense.
Because if you have enough bone, there's no need for it.
Yeah.
You also don't want to condense too much depending on the case.
Yeah, because sometimes...
You don't want to create too much pressure on the implant when you're placing it.
Yep. So what implant are we placing? 3.7,
Nice
5. It goes up to 3.2, this implant. So what am I at? 3.0. Okay, so this is my last burr.
So it's gonna give you a really nice femoral stability now.
Okay. And that's that. And then the last burr is 3.2. So you were asking like, hey, why don't you just shave off the bone before you do? So this time I'll show you that we shave off the bone. So for this part here, when you look at that lingual, she has about 3 millimeters here. So we technically just have to shave off 1 millimeter around this area. But if you look at the bone ridge here, you know, it's a little odd, right? So let's just shave it down and contour it for her. So let's see. I have a round burr for that reason. So sometimes these burrs don't work that good. Okay. So a millimeter off. Can you see, Dr. Sam?
Yeah,
Okay. So don't take bone off from the tooth. Okay, you want to save that bone. Right here. And then this side. Honestly, I have more control with the rounder from a high speed. So I'm just showing you this because there's different ways to do it. So Dr. Golar asked me to do it this way.
I asked if it makes sense.
So I did it that way. Now I'm going to just do it my way. This is faster. Yeah. So I'm going to level it out a little bit, okay? But, you know, you also don't want to remove too much of the bone here because when the soft tissue heals, the soft tissue will just close into that space. So let's say you're just imagining and then this side, you contour the bone to make it smooth. Because ultimately, the bone here, the height of the bone is what will hold that gum tissue space in place, okay? So let's say it comes like this. Right? I don't know, I wonder if we could just kind of go like that. Yeah, okay, I'm going to show it on. So typically, again, edentulous ridges, you don't have 3 millimeters of space, unless like the patient has a very thick gum profile. It's usually about 2 millimeters or so. Okay. So after I'm done with this, you always want to make sure you contour the bone and shave it down. I'm just going to go in. Make sure it's a little bit smooth. Okay, so we're now ready or semi-ready for the implant there. 3.7. So it's going to be a 10 millimeter implant. I have to check what it is. Okay. Okay. So after you do that, you want to make sure you're rinsing out the implant or the osteotomy site, because whenever you do any type of drilling, there's always a little bit of like that bone speck in there. So just rinse it out. And then we're going to place the implant. Oh shit, sorry. Did you see that? I forgot that. The implant on
We
the
see
top.
that you're killing it. Keep going.
No, it's because the implant.
We did see that.
Oops. Okay. All right, cool. Where's the implant? Okay, so now the implant goes in. Oh wow, this one's not done perfectly. I think I over prepped. Shit. Okay, so this one deserves a cover screw. Okay. Shit. Okay. Yeah, I over prepped. Oops. Actually, what was the torque value on that? 5? Nah. Okay, so this one you need a cover screw. Okay. So let's see.
How can you tell that you overprepped?
Cause it just spun
Oh, it
it,
just
spun
covered
it, yeah.
that.
So I guess I went over one. Oh shoot! It was a 3.75, and I put a 3.7 burr. So okay, so that was my mistake. So she's gonna have to wait a little bit. So let's talk about soft tissue management in that space, okay? Or am I feeling extra risky today?
I like it.
Okay, maybe we'll just do the cover screw. I'm pretty sure that thing is gonna heal really well. And then the thing about the Straumann implants is that they're very the surface is very different. Yeah, so a lot of the times with these implants, with Straumann, they say that you could wait a little bit shorter of a healing time to go ahead with this. Yeah, so suction please. Let's see. Suction. Okay, so if it falls out, I'll just redo it. But okay, there we go. So typically when you put it in, there's like a little click because there's like 6 notches for you to be able to click it into. So now that this part is done, and we hope that the implant doesn't move, and it's moving. Oh, great. It's okay. It'll stay there. Let's just hope it stays there. So now you can see that here. Let me bring it up. When you look at the gum tissue, you're still short. I have to still push it in more. You see? Because actually, that's fine. Actually, never mind. That's fine. So that's fine. Never mind. Because it's a 5.5 millimeter height. Are you looking for something? Okay. So this should be fine. So we're going to finish off with the sinus lift now. So let's see. Where's the bone? Oh, okay. So we'll finish off with the bone graft. And then we'll talk about soft tissue management. Here. Thank you.
Go back to the sinus lift.
Yeah, so I don't fill it in completely 100% until the implant's placed. Because once the implant volume goes in, then the bone, it's a little different. You could feel the implant, like I could feel with my instrument, I could feel the apex of the implant. So you go back and then make sure you fill it up like around here.
Now I get it. You need it 1, 2, 3.
Okay, more please. So, and then as you were asking Dr. Pham, the way that you know is kind of feel a resistance. But it's like a cavernous cave. Like it just keeps filling and filling and you're like, what the hell? Yeah. So we might end up using 1 cc. No. Or more. Or just hope that it just settles in so you don't have to do more bone graft. Okay. So I think that's pretty much it. I think we might need more bone, huh? Oh man. That last sliver was like our last hope. Yeah. No, I think we need, yeah, like 0.25. Yeah, there's still a lot of bone space left in there.
Don't get it.
Okay, I'll hold it. I think this should be on the bottom corner. Thank you. We're almost done. Christina, do you place implants at your practice?
I do, but it's yeah, I barely just stop them. I got the CT I told you.
CT?
The CBCT is installed at like we're getting there. But yes.
She's setting it up.
But
Oh, he's setting it up. Okay.
Yeah. Everything takes forever, so
Yeah. Oh,
no, none of the sinus stuff.
I see.
Yeah.
No, I don't think I'll do that.
Probably not.
Oh, you're seeing our treasure stash. Yeah.
I use that for the same reason when a tongue pops off.
Oh, yeah.
So I've heard of dentists or like just single implant, they'll use a stent and go through the gums, but is that like just sloppy implants? You should always flap and
I think if you have a lot of real estate, then yeah, you could try it that way. But as you can see, you know, there's a lot of bone undulations that may need to be smoothed out.
right.
So, you know, if it's like a completely flat bone, wide bone, then yeah, you could probably do that. But it's hard for me to come by those cases. I don't know why. Yeah, it's hard. Do you mind putting those back in? I'll take this one.
We're gonna need it later.
Yeah.
So you're gonna do like functional you were talking about, right?
Yeah.
Yeah.
So I think you have a lot of keratinized tissue and
Yeah. So yeah, I don't come across a lot of those. Oh shit. Okay. Okay. Let's see. A little buzz. Okay. Ready when you are. Let me know. Let me know when you're ready. I think this is good. Ready? Thank you. Oops, sorry. Let me have you hold like that. Okay. Okay. Bring it a little closer so I don't drop it. Thank you. Okay, I think that's good. Okay, so now I'm just like, okay, I feel resistance, right? So I'm like, okay, I'm reaching my near. Huh?
it's never ending, yeah.
It's a hungry hole.
You're still packing it in the sinus?
Yeah, it takes a while. You could have like different bone graft, but I don't like paying for it. So. Yeah. You know the ones that come in the syringe? I'm like, I don't want to pay for it. Yeah, it just comes like you could squirt it, but I'm like, I don't want to pay for it. So. Yeah. Okay. All right, that's it. So we'll have to do it. So I'm gonna suction. I think I need a little more. Let's get a little more. Okay. Is it? Yeah, I think that's it. Okay, let me get that suction tip. So you have to close that hole. Why? Okay. So from here, just wait. I have a membrane that I was trying to use before. You just close it. That's it.
So full.
Yeah, we could use a 4.0 for her.
She placed mine in 5
So let me just take a look and see. So from here on, this is when I start assessing the gums, right? And I told her I might do a gum graft. Let me just put a little bit of. Okay. Is she okay with the water? Okay. Let's see. You think it's too soaked, or should we just finish it? Let's just finish it, right? Yeah. Okay. So a lot of the times when you're operating, let me have your holder here. The flap loses water. Lift it up. You have to split it.
Say again, please.
Oh, she's gonna split it.
Split it.
Out,
Like,
out.
cut the periosteum out so she can pull the flap up.
Yeah.
You just get half of it. This is really hard to do.
Yeah. So this is what makes everyone very swollen. Yeah.
So you increase the elasticity to pull all the way out.
There we go. Ooh, she moving.
Because you said it loses water and shrinks, or
It just loses. It just kind of, yeah.
Kind of contracts,
Okay.
right?
So
Yeah.
yeah. Okay. Relax this gum a bit. Sorry. Let's see. So I'm trying to figure out. Okay. So thankfully for her, when we do the flap design, right? Intentionally leave some keratinized tissue at the front. You see? I'm just gonna leave it there, and let it. Actually, wait a second. Let's see what we need to do for her. If the flap goes in here like this, she's gonna lose tissue over here. Let's see it. This doesn't look right. I don't know. So it's like this, and then this part is a little bit shrinky. You know what? Then let's cut this part here. Yeah. Okay. So periodontal touch.
Aging doctor number 10.
Huh? I'm gonna de-epithelialize this tissue.
Got it.
There we go. Same thing. Oh, sorry. Same thing on this side. So I'm just de-epithelializing part of the tissue here. Sorry, you can't see it because there's no camera. But like this. No, I'm not cutting anything. I'm just gonna roll the flap in.
Right?
No. So I'm gonna roll the flap. Where's the membrane? So instead of cutting tissue, I'm rolling it in.
yeah, yeah.
And I cut too much of this part. I cut less of that part. Oh man. Okay. This part needs to be rolled in more. So let me cut more. So basically I'm just de-epithelializing a part of the flap so that I could incorporate that. Like I'm basically taking out the epithelial layer. For sure. Yeah. And then just leaving that connective tissue. So I could have CT left in there. Okay. So that one's done. I'll just roll this one too, just in case. We're almost done. Okay. Okay.
Into the wet floor.
So I'm gonna roll this flap in, you see? So I created that connective tissue layer so that you preserve all amount of that tissue there. Does that make sense? This one is a little thick. And you know why? It's because of the bone right here. I do not like this. So let's say I roll it in this way.
Is that the thing?
No, so look, this is not working out. If you look at the gums, why is it so limited? What happened here? Sorry, I'm talking to myself. You know what? Suction right there. And right there. Thank you. I'm not liking this at all. It's a little bit hard. Okay. Let's see. So gum tissue. You know, this side needs to be split a little more. You know what? I think we should get a little bit of nice tissue here. Yeah, we'll get a slice. So let's do this. Okay, I'm gonna close up first, and then. Thank you. So we're gonna use traumatic gut for her.
Are you leaving the abutment on for the premolar, or do you just do it?
This one?
Yeah.
So with that one, if you bring up the gums, it's at the right biologic width. It looks a little high, but it's at the right width because this one is actually 5.5. Section right there. So it looks a little short or a little tight, but the measurements are there.
No, I think he's acting like you're not going to put a cover through. Because initially.
No, I'm gonna hope for the best. I'll let you guys know if it comes out.
Yeah, give us an update.
Yeah, but I think it's gonna stay. I think it's gonna stay in there. I feel. Wait, this one is not in there. Okay. So I think we'll be done in maybe maximum half an hour. Okay. Relax a little bit. Thank you. Let me see where that papilla is here. Okay, I'll go with this one first. So when you're sewing, you just want to make sure the edges are together first. Where did it go? Oh, so. Section right there. There you go. Even better.
Glued it. So much if you could just do that there.
Okay.
It's not gonna put there again.
Huh? Sorry?
We're talking about would it be so nice if we just could use
like
glue
tape,
Oh.
and glue it back in place.
When you design, when you invent that, let me know.
all right.
All right.
Let's do it, guys.
Like,
Yes.
that'll probably be a
Right?
$10 billion.
Let's do it. Well, yeah.
No,
but
like tissue glue.
Approximate the whole thing. I mean,
You just kind of guess it.
exists.
Yeah.
I don't think you
In the
ever
back?
can do
But not like, yeah. I like this staple
Because you have to
feature.
approximate it. Soft tissue runs through it.
Section right there. Oh. Is she okay?
Oh my god.
Why?
No, I'm joking.
Oh. Why?
Pinched her.
It wasn't me?
No, this is just a sloppy job over here.
Okay.
So she is under general anesthesia, but she's still ventilating on her own.
Yeah.
So that's why she says sometimes we've seen this moving stuff that are moving her.
Where is the
You know
thing?
what I mean? That's what's happening.
Okay. Yeah, we're almost done, but you know her gauze is a little soaked.
It's okay. Don't worry about it.
It's okay?
Yeah.
Okay.
I'll touch it now.
Test it.
Sorry guys, I'm blocking you.
Yeah, this is a tedious part.
Squeeze in. Come.
So over here, you see how like this area here is deepithelialized, right? So that's going to be your direct connective tissue contact to this spot right here. So a little trick. Yeah. So that way you get more tissue thickness around that space.
So you can't do that with glue.
Exactly.
Definitely can't do it.
You could invent one. That's what you're saying.
This guy thing I was like him.
Be some scientists and some.
He said in 2 days in the lab, you would quit. It would not take 2 days.
No.
That's funny. I do dentistry also. Not every day, but yeah, it depends on the day. But mostly I travel and do sedation. Yeah. Today? No, she doesn't work Fridays. Fridays, everything's closed. Other than me, I'm never closed.
Huh?
She was asking if my wife's working, I said she's
On
closed.
Fridays?
Yeah. I feel like a lot of GP offices are closed on Fridays.
Yeah, they do close a lot on Fridays. I don't see a lot of GPs working on Fridays anymore.
You see it here, but her hygienist is working.
Oh, the hygienist? Yeah.
My stuff.
She's collecting.
Let me see. Oh,
You know what? This side here. I'm gonna just leave it there. All right, let's get a slice, yeah? Or actually, I don't mind that bone going down a little bit. Yeah, it's okay. It's a non-critical zone. You know what? Should we just leave this area open a bit and then get some drops in there? We should. We just leave it here, because then if we bring it there, how much does it matter? Nothing in my hand. No, let's let it heal by secondary intention. So she's gonna hurt a little more, but I'm going to leave it open, this gap here, so it heals by secondary intention. And the reason for that is I'm trying to increase that band of KT. So I'm actually gonna make it a little bit less tight here. And then just leave it open. So she has enough bone, but I don't mind if it goes down. It's exposed. So,
Between the two implants, you're leaving it a little bit open?
yep, so she could get more nice tissue growth in there. Thank you. And then, yeah, so no hard tissue. And I don't mind if that bone kind of goes down a little bit too. It's just I'm not worried about it. But it does mean that she will suffer a little more when she heals. Yeah, she'll be okay. Dr. Daniel's going to give her really good pain meds, so she'll be fine. Okay. So then after this, we just need to close up the verticals and then we're good. Oh, and then we have to cover that hole. Okay.
The question, she's completely under, but you used a little bit of anesthetic still.
Local numbing?
Yeah.
Yes.
There's still a pain receptor there.
Okay.
So especially soft tissue.
Okay.
So even when you're under, unless you're just doing something that's solely an enamel and dentin, then you don't have to localize. Then the local becomes post-operative pain control. So when you're doing surgery, you're doing endo, you're doing root canal, you're doing things that are more invasive, you have to localize that. It also minimizes what you have to do intravenously. So good local is the best.
Do you give out antibiotics?
I can, if you give it IV antibiotics. Is that your question?
No, I was just curious, like if you do pre-op and then.
Oh no, I never prescribe post-op.
Okay.
But I can. If you'd like me to, but no, typically the surgeon themselves prescribes whatever pain regimen post-op. Whoever did the sedation and anesthesia in-shot care, essentially.
Okay. So this is our last suture.
After you did that last stitch with that sort of a thread.
Oh.
Wow.
The.
How is she doing?
Where is it?
She is just like this big.
By now, literally.
Oh no, it's because when you don't want to open up a new suture, you calculate the cost in your head, and you're like, I could do it.
Just PTSD.
Yeah. You're like, oh no, I'll make it.
Oh my god, hilarious.
Yeah, you'll do it. You'll make it work if it's between
So
that.
with that, it depends for patient, depends on the metabolism, depends on adequate depends on how long it is. The longer your suture,
Yeah.
the longer
Where's that
She's
bed?
just grabbing air. It's actually not.
Where is it? Where's the end? I don't see it. Oh. Okay, I got it. There you go. All right, so we are good to go. So Jocelyn, do you mind putting in that tampon and the composite, curing it, like rinsing it out really well? Okay.
You take an X-ray?
We can take it at the end. So we'll move everyone out.
Okay.
All right, so you guys, everything is pretty much done. So Jocelyn's just going to clean it up, put in that Teflon to cover that area, and then put in some composite, and she takes x-rays, and we're done. But we're done. Wow.
Yay!
Yay! I'm so happy. We're all done. So today we'll go upstairs and debrief. And then if you guys have any questions about the procedure, oh, selfie? Okay. I like my hair. All right, everyone get in. Do you want to get in?
Come on, everybody.
Get in. Is there space? Yeah. Oh, man. Wait, maybe not with the patient like this?
Oh, yeah.
Yeah.
Cover the patient.
Oh, wait. Really?
Yeah, come in front. Yeah.
Okay, because I don't want the patient
Come right
to...
here. Come right here.
Okay, here. Okay. Ready? You guys, go come closer. Oh.
I can be right here if you want.
Oh, there you go. Teeth.
Is the assistant going to be in it?
Jocelyn?
Not in it right now. Okay. Okay, and then maybe I'll do one on that.
Yeah.
Okay, cool.
Let's do one more on here. Let's do one more.
All right.
Kind of squeeze in everybody.
Teeth.
And then we get some energy for the video.
Oh. All right, ready? What's the energy?
What is the energy?
What's the energy? Positive.
I don't know. Wait, music.
That was enough.
Like, calm down now, calm down.
Feels like you're
All right, cool. All right, thank you so much. All right, you guys, let's go upstairs. So move the herd. I have a question. That camera, so it.
They told me what we should do,
Uh-huh.
and it's backup camera or a dummy battery.
Dummy battery.
So then we can just have
I'm
it
going to bill you a
charging.
consulting fee.
I mean, hey, I'm gonna buy you a drink after this, so don't worry.
I actually have to go do a walkthrough or something. But
No.
I can meet up afterwards. Maybe like 4.
We're okay. Maybe we'll still be out. We're old ladies here, okay? Yeah, we're done. Yeah, it is Friday. Oh, don't worry. We're gonna bring the champagne upstairs when we're done. Alright, we're gonna go to Martha's gonna take us there. Let me just grab my cell phone.
Okay,
Alright, thank you so much. Hopefully I'll see you after, yeah?
Yeah.
Yeah, Martha will be there. Don't worry. Okay. Okay, sounds good. But thank you so much. Hey, but I was gonna ask, because we still want to have like a YouTube and all that stuff done. I think I spoke with you on the phone, right? Yeah, Martha and I, we've been talking about it for a while, but it's never come to fruition. So I'll have it. I know you're a big fan, so
Pay for my food and chat.
Oh, of course.
See what
Let's do that.
I hear you got a lot of stuff going on. So
The YouTube stuff or?
just in general, like the marketing is.
Yeah, no, like I have to be on America, and she's like such an amazing person. But I mean, like, we're kind of like, whenever we find something like a night, we're like, we need to pivot to this. So we'll have like a little, perhaps all we have to do is feed him. No,
Start there.
I'll take care of him.
Start there.
So we'll wrap up after dinner. It's kind of like 2 days proud. Okay, so let's go upstairs. So there's more food? Yeah, there's a lot. Oh, okay. I knew this was gonna happen. So, the last bottle of champagne, I think we should do a toast with that. Okay, so I'm gonna talk to them about the
guys going after?
Where are we going after?
Okay.
So one person goes up with me, one person takes care of the.
How do I leave? Where do I go? What? Where's that one? I'm on the right foot.
You're on the right floor.
Oh, that's nice.
My name is Jackson. I'm from